the students are going to have the support when they're in these spaces. We have done a lot of hard work to ensure, from the academic side to the mental health side with CAPS and student health, and I'll be working with them just to ensure their comfort level. Hello, my name is Patrick Venner. I'm the Director of Residence Life and Housing here at the University of Richmond. I have served as the chair of the Isolation and Quarantine team, and then I shifted to the Isolation and Quarantine Case Management and Support for Students team. What we were looking to do was to provide spaces that were not in our residential areas or where students were living, but we landed on an idea of bringing in these modular units, and we were lucky to get in contact with a great company to get them here in advance of the students returning. And we were the only school in the state that was able to secure them. So we did work with an immunologist, and they had proposed to us a 5% number for us to look for. And so we were able to secure the amount of modular units for quarantine and isolation to meet the guidelines that were given to us for the amount of students we do have residing on campus. We have 5 10-person units, and then we have 25-person single units. The single units, those that are closest to the Student Health Center, we'll be using those for isolation because they are single standalone bedrooms, and each bedroom has its own private bathroom internally. So there's no reason why that student would need to leave. And when someone's in isolation, they should only have access to their own space, their own bathroom, and they're there. With the quarantine units, we're able to house more students in one unit with shared bathrooms, and those are all under guidance from the CDC and the Virginia Department of Health. Once we know that a student is either tested positive or symptomatic, we have protocols set up in place where we're working with our Student Health Center, our police department, and the Residence Life and Housing team, and we are meeting the student wherever they are to get them with all their items and transported to the units. We thought about what are all the needs for our students from an academic standpoint, from a mental health standpoint, and from the medical standpoint of monitoring their symptoms of student health. But then we thought, they're going to be in a space for 14 days. What amenities do we want to ensure that they have at a very minimum, like any student would have in their room on campus? So every room comes fixed with a twin-size bed, dresser. We're going to be installing televisions in all the units. There'll be micro fridges in every unit, as well as a desk and chair for the students to be able to use for studying. And then we'll also be working with our dining staff for all the food deliveries for the drop-offs each day, and just to make things as easy as possible for the students who are in these situations, whether it's for isolation for 10 days or it's quarantine for 14 days.